knee examination now. So looking at Richard's lower limbs bilaterally, looking at alignments to see any asymmetry here, and whether any surgical scars or any lower limb malalignment or muscle wasting. Can you walk forward for me, please, Richard? So looking at his gait, he's got good bilateral symmetrical forefoot progression angle. He's got good heel strike and toe off, and the knees fully extending and bending in a normal fashion. Thank you. If you can squat down for me, please. Looking at his squat, that's a good functional assessment to test for medial meniscal tears, bucket handle tears, and do a single leg hop forward for me. Excellent, thank you. Come onto the bed. So the ACL rehabilitation single hop test is quite a robust test to see that he's doing well from a post-surgical candidate point of view. There's a small scar over this area. We'll move on to examination, looking at muscle wasting, asymmetry or any scars, and there's nothing here at all. Can you tense the muscle for me, please? Thank you. So I'm testing for bulk and tone, and they're symmetrical. He's got good resting tone, which I think is important in patellofemoral mechanics. Lift the leg up straight for me. Thank you. And bend this as much as you can. Keep it there, so there's no extra passive movement. Lift that leg up nice and straight and bend that for me as much as you can. And again, he's got symmetrical full range of motion, flexion and extension with no extra passive movement. Straighten this leg and that one. We're now going to make an assessment for an effusion. So I'm milking the suprapatellar pouch, emptying the medial gutter and then pushing out against the lateral side, and there's no fullness there. You can also test with the patellar tap in this region, and there's no pain, no fullness or discomfort. Any pain here at all? That's over the quadriceps tendon, over the patella, the medial side, the lateral side, over the patellar tendon itself, there's no pain here, over Hoffer's pad, no discomfort at all. Very good. Okay, so I'm going to take the knee now, partial flexion for about 30 degrees, and testing for medial and lateral collateral ligament instability, and there's good firm endpoints, a little bit of play, but that's completely normal, and it's comparable to the other side. Just bend the knee up for me now. Okay, so I'm just going to have a feel for the meniscal tenderness around with single point on the lateral side, looking at the patient as I go along on the lateral body. There's no discomfort here at all, and here on the medial side, no pain at all. You can also feel over the tibia and femur for the MCL attachments over that area. To perform McMurray's test, my preference is to put your hand over the area itself, hold the foot in a cup position, and then you can cycle and load in this manner. That's testing on the lateral side, no pain at all, coming out into extension. And the same thing on the medial side, cycling and loading, looking at the patient for the medial meniscus, and that's negative. In order to assess for the cruciate ligament, we can do a number of tests. Bend the knee on both sides, checking that it's symmetrical. At this point, you can also make an assessment to see about leg length discrepancies. So the tibia have the same height, and if you come this way to look at the anterior tibial tuberosities, they're equal on both sides, so his limb lengths are normal. You can then sit on the patient's leg. You just come this way for me, please. Thank you. I'm going to test with the anterior draw test for ACL, and that's negative, and posterior sag test on the for PCL injuries, and that's negative. We can also then do a quads active test for making sure that the heels are symmetrical at the same level. I'm keeping an anchor on the feet, and if you try and straighten your knees now, and if you look at the tibial tuberosities on both sides, go for it, and relax. So the tibial tuberosities remain in position, and it doesn't come forward, which would be a positive quads active test for a positive PCL injury with PCL sag side. Put this down for me. In order to make further assessment of the anterior cruciate ligament, we can do a Lachman test, and that would be to relax the patient like that, and then hold the femur on the tibia, and then draw it forward, and there's a good firm end point here. And then to do a pivot shift, we can take the leg like that, apply a valgus force, bit of rotation, and then flex it around to see, and that's completely normal. Fantastic. To assess for posterolateral corner injuries in PCL, we can do the dial test. And actually, we were talking about this. I think it's quite functional to do it sitting supine, because you can actually then see the posterolateral structures and whether they sublux or not. So 30 degrees, holding the leg, having a feel in this area, and dialed at 30 degrees, and that's negative, and then again at 90 degrees, and that's negative. And actually, if you turn around, we can do the same thing for the dial test with the patient supine in a more classical position. Thank Thank you. So again, here, that's 30 degrees external rotation, and then again at 90 with external rotation, and that's completely negative. Thank you very much. Just come back round. I'll also then do a functional assessment of the joint above and below. So the ankles are moving well up and down. It's got good stability here, and if you bend your knee and rotate the hip, it's got a full functional range of motion at the hip as well. Thank you very much.